breakthroughs that we will tell you about tonight, and some simple things that you can do, several different procedures, and when you put them together, you're going to have an absolute home run. So just like we have Botox for the face, and we've got fillers for the face and different parts of our anatomy, lasers for our face, décolleté, and yes, we do use lasers in the male organ to improve Peyronie's disease, which is the curved penile issue, as well as erectile dysfunction. We also use lasers in female issues. So whether you've got labia that are changing and cosmetically you don't like them, or you're not getting the same sensation in the labia, clitoris, and vaginal orifice, the lasers will absolutely improve sensation, libido, and climax. Well, up until now, that took us so far. We still have the problem of the urinary incontinence, where ladies were leaking urine either with a cough, a sneeze, laughter, or just can't get from the car to the house or to the restaurant or to the whatever fast enough. And quite frankly, it's very embarrassing. If you've got a new partner, you may be a little bit shy about getting into the bedroom. So it may have been that perfect golden moment, but your bladder was a little full and you were afraid in that romantic situation you could have an embarrassing leakage. Well, now we've got a breakthrough, and it's proven. So it's FDA cleared to improve not only urinary incontinence, but also libido and the ability to have a climax, achieve climax, and have better orgasms. So for many of us, as we've gotten older, we've lost that ability to have that youthful orgasm, or some ladies have never even learned how to achieve that potential. So we do a lot of sexual counseling, again, whether it's telemedicine or in one of our 2 offices in Louisiana, or when we're doing live events in Florida and Alabama, and we offer one-on-one counseling to kind of get you through those circumstances and giving you a broader horizon. Because let's face it, intimacy is a part of life, and as couples get older, they don't want to lose that intimacy. Or it may be a widow or a widower, or someone who's divorced, or someone who's never married, that are finally getting to that stage later in life, and it's a very important stage. And it has been proven scientifically that intimacy and sexual relations and romance and passion can be a lovely dance. It can be a lovely hug. It can also be bedroom sports. And no matter what the degree, they all extend life. They're very anti-aging to life. And it's not just a theory or a myth. It actually releases oxytocin, and it extends the telomeres of your body, which determine how long you live. So let's get happy, let's get healthy, and let's get sexual. One of the things that we can do is what we now know as high frequency electromagnetic stimulation. That's what you're seeing here. And we're going to go on and turn on. This is one of our clients. She's actually gone through the whole process. We'll be talking to her shortly, and she'll tell you a little bit about what her experience has been. And now she just does sort of renewals or
more maintenance.
Yeah, maintenance, muscle recovery. It's just like if you really, if you lost 50 pounds, you wouldn't stop going to the gym. You may not be going 6 or 7 days a week anymore, but you're definitely going to go 3 or 4 or something similar days per week to maintain the muscle memory that you built in your arms, legs, or whatever. It's the same thing. We're going to rebuild that pelvic floor, and I'll show you a little bit about what that stimulation looks like. No. So, you may or may not have heard of the muscles called the Kegel. So when we do Kegel exercises for pelvic floor, as the pelvic floor ages, loosens, and it can happen with obesity, and as we said, childbirth, menopause, or just plain simple aging, that pelvic floor girdle gets loose. You don't really feel it because they're internal muscles that surround the perineum. The perineum are the muscles between the rectum and forward the vaginal orifice and then the clitoris. And when those muscles get weak internally, we start to do things like lose urine. We also lose friction during the romantic interlude and sensation. So we want to keep those pelvic floor muscles tight. Well, exercise, regular exercise, can only take us so far. We need the Kegels. And so what do the Kegel exercises do? They take the pelvic floor girdle and they stimulate the muscles internally. The stronger that pelvic floor is, for women, for what we're talking about now, but not only women, for men, it helps benign prostatic hypertrophy, otherwise known as BPH. It helps erectile dysfunction, and it helps prostate cancer. So this is important for men and women. So it's not just a female thing, but it's important for both. But tonight we're focusing on females. If you'd like to hear more about how it can help males, you can go to my YouTube channel, Dr. Burkenstock Skin Body Health, or look back on our Facebook feed where we did male incontinence and erectile dysfunction 2 weeks ago. And it'll be there forever, especially on the YouTube channel, Dr. Burkenstock Skin Body Health. We've been having episodes up there for years, and they remain there. But without further ado, let me turn on your treatment, because I'd like you to see how comfortable it is for the patient. You keep your clothes on, so there's no embarrassment. The only thing we do is we educate the patients to open their legs a little bit, just about as wide as their shoulders, and instead of sitting straight up like you would in a professional mode, you're actually going to roll, and yes, exactly, Karen, and you're going to fanny out your back fanny, and so that your pelvic bone is actually on the chair, and then you're going to feel that stimulation grip and pull there. It's not a harmful pull, it's not a hurtful pull, it's more of a tingling and a strong vibration. If you're sitting straight up, you'll still feel it, but it's going to be towards your sacrum or your coccyx bone, okay? And what we want to do is roll forward and kick that buttocks back so that you're kind of sitting forward, so that perineum, which is the front part of the female girdle, is actually what's resting on the chair. So let's turn that on now. So you may hear a cadence, may not. Tap, 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 tap. Those are the magnetics and the vibrations tuning up, and as the muscles get warmer, the client can feel that more and more. How's the intensity, Karen? Good? Okay? Right now I've got her at a 70%. We attempt to get everybody at 100% because that's when you get your maximum treatment. Not everyone can go there. Sometimes the vibration, it's sort of like some people, you can tickle their foot, and other people, they can't stand it because it tickles, or tickling on the belly. It's more of a tickling vibration sensation than it is an absolute pain, but for some people, it's a little bit annoying. So we see how far we can push them. And then each treatment, we try to get them to go a little bit more. You're at 80, how you feeling? Okay. 90. Okay, you're at 100%. Okay, good. She's at 100%. So you can see she's not in pain. She's not gripping the chair. She's got her fanny out and she's pressed forward. Are you feeling it down in the perineum, in the vaginal area? Great. So it's sort of in the pelvic bones or in the perineum. And she's forward. She's got her knees a little bit apart. And so we know she's getting a good solid treatment. The treatments go on for 28 minutes, and this is what the treatments are doing. So on a normal Kegel exercise, and this is in the comment feed if you can't see it, TikTok, Instagram, Facebook. A Kegel, you're pulling those muscles in and pulling them up, like an elevator, in, up, in, up. So it'd be sort of like, if you don't know what a Kegel is at all, sitting on the toilet and you think maybe the telephone is ringing. So you stop your urine stream and listen, is the phone ringing? Is there someone at the door? That's actually a Kegel. And so the Kegel muscle, of course you can do these at home, and of course they do help everything that we're talking about. You pull in, you pull up. You pull in, you pull up, with the muscles down below, near the vagina in the perineum. So this is what that looks like. So you're doing one every so many seconds. And that's the fastest and strongest you can do. That's the fastest and strongest that's humanly possible without support. Now, if you look over here to the Emsella chair, it's super physiologic, meaning that you're doing 12,000 Kegels in 28 minutes, which is actually impossible for the human body to do on its own. So it's pulling in at a higher, faster rate and more intensity than the human body can possibly do. And scientifically, there's a study in the International Society of Sexual Health, which we are a member of, that shows that these 12,000 Kegels in 28 minutes is absolutely changing the outcomes of urinary incontinence and libido and female climax and orgasms. So if you've suffered with and haven't been able to enjoy your partner that for many, many years, just due to discomfort, due to urinary leakage, due to embarrassment, or due that some couples get to the point where the female and the male are together and they're in that bedroom so long trying, and the orgasm or the climax just can't come. It becomes frustrating, it becomes embarrassing, and it actually sort of deteriorates the relationship to some degree. And wouldn't it be so much greater to return to like it once was, when it was free-flowing romance, the orgasms were coming more often than single, they were multiple, and they were enjoyable, and the two partners could really enjoy each other and have that total intimacy. So if you're having struggles, we're here and we're happy to help you. I'm Dr. Burkenstock at Dr. Burkenstock Skin Body Health. We're going to talk to our clients at a moment and let them tell you exactly what they're experiencing. So Karen, right now, she's on a maintenance run. And so how many treatments in it? So if someone is mild urinary incontinence, mild sexual issues, you're looking at 6 treatments. You always treat the urinary incontinence before you treat the sex. Or the intimacy. So there's 2 different protocols, and you always want to tighten the pelvic floor before you go on to the sexual enhancement protocol. But it's usually 6 treatments for urinary incontinence, unless it's a severe case where then it would be 10, and it's 6 cases for sexual enhancement. If you've got a little bit of urinary incontinence, always do stage 1, open, before you do stage 2. So right now Karen's doing maintenance because she had done a program in the past and was very successful with it. So Karen, I'll let you speak right now. Number 1, are you in any discomfort whatsoever?
Not at all.
What does it feel like?
Just a tapping sensation.
A tapping sensation on your perineum,
yes.
on your bottom?
Mm-hmm.
Okay. So tell us a little bit about why you sought the Emsella treatment out and what it's done for you.
Started with sense of urgency. And in my job in sales, I had to stop everywhere to go to the bathroom. Sadly, I started to dehydrate because I was drinking less, so I wouldn't go to the bathroom as much. So it was really important for health reasons to get that water back in my system, but what was I going to do with the bathroom issue? So found this wonderful machine, and I was a little bit of a skeptic at first, to be fair and balanced here, but surprisingly, guess what? It worked, and I am hooked for life because the tighter the lower area is for that the incontinence part of this is so important for every part of health. So we'll let this lovely lady in time talk to the other parts of it. But yes, absolutely, I would recommend this.
So Karen was a client that did this, I guess it's been almost a couple of years ago. And so what she's saying, I know the equipment's a little bit loud, is she's in sales, she's actually in medical sales. She travels a lot and has to cross bridges and so on and so forth, where she may be on a bridge for 20, 30 minutes and can't get to a bathroom. So over time, what had happened was she began dehydrating herself, not to the point where it put her in the hospital, but to the point where, not knowing if she's crossing the 30-mile bridge, if she's going to have to go to the bathroom, well, I'm just not going to have that bottle of water. And then you get involved in a conversation at an office, so on and so forth. Before you know it, most of the day's gone by and you haven't had much fluids to drink. at a part that she didn't mention, and she told me earlier that I could. In her family history, there is kidney disease. There's also high blood pressure. So these things would really aggravate and deteriorate her health just because of the genetic component of having kidney and blood pressure issues in her family. So, we talked about it and decided that this new procedure that was available would definitely and could definitely be a home run for her. So, as Karen said, she was a little skeptical, like, what is this thing going to do and what is it going to feel like? But at the end of the story, as she said, it was a home run. So she's gotten herself out of that vicious cycle. She's able to drink, continue her job, and it's enhanced her so that she's not having that incontinence, that frequency, that urgency of having to go, can't hold it in, and she's just much more comfortable. So anything else?
Beautiful.
Karen?
It was a beautiful surprise. I didn't want to have to take medicine. I certainly didn't want surgeries. So this was absolutely the best alternative to all the above.
Great. Don't let me push it on you, but did you notice it help you in any other areas of the female life?
Yes.
Okay.
Yes, actually it did. Not knowing that part of it.
Right.
I really naively went in thinking it was just for urinary incontinence, but it definitely did.
Okay, awesome. Well, thank you so much. I appreciate it. I have another client, Karen.
So we want this Karen to have this or?
Yeah, no, I'm just gonna hit this. Okay, all right. I'll have another client, coincidentally another Karen that's here with us tonight, and she's been embarking on the Emcella chair. And I'll let you, Karen, tell us just in your own words what you came for and what you're experiencing.
Well, I'm an older lady. I'm nearly 70, and I didn't have incontinence like you eat diapers and things like that, but I did have a couple of drops coming out. And I thought, that's not too good, but, getting old. And then when Dr. Burkenstock sent something I saw something in the mail, I said, wow, not only will they stop these drops, but if you can have moisture and increase libido, especially as we get older, the desire is still there. So when we talked about it, and Blaze helped me with the machine, what it did, it feels great. The first time I was on it, I've only had 3 sessions. The first time I was on it, I never had another drop. 1 session. Then we did 2 sessions with the incontinence, because I really didn't have that problem much, but we needed to strengthen the pelvic
floor,
floor, so that after that, the machine, I guess it sets itself, or they set it somehow, and then it starts, you can feel the vibrations changing, because I started the new one today, and it moves out, and it feels really good. I don't know if y'all ever did Kegels when you were young, but it feels as good as anything could feel, not toys, but really good. So the next one, it was in a different location, and what I'm excited about this is that it will bring moisture back and increase libido. Because we all want to you feel loving, but we want to have that kind of loving too. We want to have the sexual feelings, the laying afterwards, like, oh God, this was so much fun, how wonderful. So this, I think, and my partner's doing it too, so we're doing it at the same time. So there's no pain, it feels great. After the first session, I never had another drop.
Great. Thank you so much, Karen. I appreciate it. And I do appreciate these lovely ladies and clients, because these are topics that aren't easy to talk about. And you have to be pretty brave to get on camera. But they know, like me, if we talk about things, if we share, if we communicate, and I continue my studies. I go internationally and study about sexual health and anti-aging. And then I want to bring that cutting edge topics back to you, because we're all in this together. We're all getting a little bit older, and we want to have our best life. It's kind of like just when the caterpillar thought it was over, life was over, she became a butterfly. So you're in the butterfly parts of your life as we enter this phase that we call menopause, and it's going to be the best part of your life. We're here to help you. We're here to help share it with you. You can reach us at info@skinbodyhealth.com. That's info@skinbodyhealth.com. Dr. Burkenstock, it's BURKENSTOCK, Dr. Burkenstock, and our YouTube, Dr. Burkenstock, Skin Body Health. So it's our pleasure talking with you tonight, as always, and we'll be back in a couple of weeks, and we'll share some other new and exciting topics with you. So you take care.